we will run very special lecture series on protecting yourself from COVID-19 in the workplace. I'm Dr. Pervez Ahmad. This is lecture number 6. And this lectures, we will have a discussions on engineering controls of COVID-19's additional administrative controls that can be utilized to protect you from COVID-19's decontaminations of the sites where the workers do the work and the use of respirators. So let's proceed toward today's lectures, engineering controls. The engineering controls, it consists of the ventilations. I mean, we have to make the workplaces as ventilated as possible. Drive-through services, plastic shields and other barriers. I mean, we should do the arrangement plastic shields and other barriers. We should provide the sneeze guard. Engineering control for high exposure potential job and the healthcare and the laboratories. Example includes negative pressures isolation rooms, biological safety cabinet, HEPA filtrations, UV irradiation systems, administrative controls and work practices to reduce exposures. This enables sick workers to stay home, establish work from home policy, minimize contact among worker and client, discontinue non-essential travel, limiting the number of staff present for high potential exposure tasks, training, additional administrative control. Soft barriers include use of tables, roofs, signs, and floor marking to maintain social distancing. Adjust policies to reduce exposures. Policies that can help to reduce exposure to COVID-19 include encouraging workers who are ill to stay home without fear of reprisal or loss of pay to pay or benefits. Using email, phone, teleconferences instead of face-to-face contact. Decontaminations. Employees should develop site-specific decontamination procedures. Depending on the workplace, decontaminations may require consultations with the health departments or use of consultants specializing in the environmental cleanup. Use of an EPA registered disinfectant effective is recommended. Worker and building occupant protection is essential to protect against the virus and adverse effect of the disinfect. Respirators. Respirators are needed when there is a potential for aerosol transmissions. An N95 respirator is the minimum level of protections to prevent inhaling coronavirus. Advantages of reusable respirators, that is, it is durable, stand up to repeated cleaning and disinfections, maintain fit over time, cost saving, powder air purifying respirators, hop or pull pace elastomeric respirators. Surgical masks are not respirated, be remember, because surgical masks do not fit tightly against the skins to form a seal. Filter tiny, it's a filter tiny particles such as viruses or bacteria that are in the air. Respiratory programs must comply with all the elements of OSHA Standard 29 CFR 1910.134. Written is a written program selection according to hazards, medically fit to wear, fit testings, ensure proper use of respirator maintenance, labeling, color coding filters, employee trainings, program evaluations, record keeping, PPE for job with high potential exposures, face eye protections, gloves, gowns, respirator, which at least N95 for or full or half a pace elastomeric for uh, greater protections. There is a worldwide shortage of PPE. Be remember, I mean this is the thing that everyone should keep in mind. Training and drills must be hands-on and frequent, should not be primarily computer-based or lectures, must include an opportunity to drill the actual process of donning and doping PPE and respirators, should include a trained observer, covered site-specific decontamination procedures, preventions in all work settings, wash hands after removing gloves or when soiled, wear a mask, keep common surfaces such as telephone, keyboard clean, avoid sharing equipment if possible, minimize group meeting by using phone, email, and avoid close contact with the meeting or necessary. Consider telework, limit unnecessary visitors to the workplace, maintain your physical and emotional health with rest, diet, exercise, and relaxations. Potential of essential workers, fire, police, grocery store, gas stations, utilities, communication, and healthcare facilities are examples of the essential industrial industries and operations that remain open during a pandemic shutdown. A site and job task specific risk assessment should be conducted to document the necessary protective measures. Social distancing may include use of barrier signs, modifying work procedures that require close human interactions. Other steps include increased cleaning and disinfection, use of PPE and respiratory training. That's all we have for these lectures. Stay tuned to the next lectures. That should be lecture number 7. That should be the last lectures where we should discuss the effect of COVID-19 on mental health and stresses and the role of the vaccines and protecting you from COVID-19 at the workplace. So stay tuned. Till then, bye bye.